Further debate? I recognize the member for Waterloo.
It's a pleasure to join the debate today on the throne speech. I have limited time because we go to question period, but for the time being, I want to start off, of course, by thanking the very good people of Waterloo for returning me to Queen's Park for the 4th election. It was a very interesting election, I must tell you, and I'm sure we will be debriefing on that. I also want to thank the members for Durham and Ajax for your inaugural speeches and for getting the chance to learn more about you. I also share the sentiment from the member of Ajax around collaboration. That said, I mean, this morning I just found out that the government House Leader shuffled us around at our committees, so I'm hoping that maybe she could speak to the government House Leader around collaboration and around respecting the opposition, because I was really looking forward to serving on public accounts. I also want to say thank you to my family and my friends and my campaign team. I am supported unbelievably, actually, in Waterloo by the community and by the election team that's brought me back to Queen's Park. That trust, I hold that trust very closely in my heart. It is a huge responsibility. Actually, it is in the prayer that we start with every day here, where we are called upon to actually put the people that we serve first in this place. And I hope that this actually is a very different legislature session than it was last time. One can be optimistic at this stage. It is day one, and we haven't had question period yet. With that, also want to pass on my congratulations to the Speaker. I must tell you, that was a good day for us on this side of the House, for the opposition and the independent members, and I truly enjoyed dragging you to that chair. I am going to be sharing my time with the member from Toronto Danforth, who will continue on with the throne speech comments a little bit later on today. I want to start off by saying it was very noticeable. The tone of the speech from the throne was very somber, and it was a sharp contrast, actually, to the first throne speech that was given in this place in 2018. There are two notable increases to the budget that has never been passed and or debated, because prior to the election the government dropped the budget and then went to an election. That is not, I think, and we think on this side of the House, the best way to provide financial oversight and accountability. And honestly, that budget did not meet the needs of the people of this province. It did not. And it did not address the inflationary pressures that we see in the province of Ontario. 8.1%. As the finance critic for the province of Ontario, I track the money very closely. There is a very disturbing pattern of the government, the Ford government, whereby you budget money for health care, for education, for some investments in infrastructure, but the money does not make it out the door. And that is why we actually have a $4.8 billion contingency fund that is unallocated. Now, we know that investing in the health and the well-being of Ontarians is good for the economy. We know that because this was a key lesson from the pandemic. When the health and well-being of Ontarians is compromised, we are in a position where the economy comes to a standstill. So I want to preface my comments by saying, Mr. Speaker, that there is a huge disconnect between what happens in this place and how that budget was designed and the real lived experiences of Ontarians out there. I'm going to start by saying that yet there are two additional expenditures that were not in the original budget, and one was around education. And I also was a school board trustee for 10 years. I was the president of the Ontario Public School Boards Association. Education brought me into politics because education is always worth fighting for. And if you get it right, many other factors fall into place. But in the throne speech yesterday, there was a promise of $225 million to help kids catch up. Now, one thing that we can agree on is that there was serious learning interventions in our school system because of the pandemic, and that mental health in our system right now, both from a staffing perspective and from a student perspective, has been challenged. And mental health was already a crisis prior to the pandemic, with 1 in 5 children suffering from mental health challenges. This $225 million was, no details were given about it, except that it is called a tutorial program. If you do the math, this is approximately $90 per student. Now, $90 per student is one tutorial session. That is not a catch-up policy. That is not an earnest policy. That is a gimmick, and it will not work. Not only that, we were very clear yesterday, our interim leader, when we were asked about this money, that $225 million would go so much further if it was invested in the public education system. All of us hear the same calls for action. We need more educational assistance. We need more child and youth workers. We need more mental health resources in our system. $225 million is not a lot of money. So let's be clear about what the intentions of this, and drawing that money out of public education also does not strengthen those values that we have around public education. The other issue was ODSP. So $245 million, 5% increase to those who live on ODSP. And I have to tell you, the finance minister was challenged yesterday by several reporters on this, and he was asked a simple question: can you live on $1,169 a month? Because now it's about the raise will only go to $1,227. It's approximately $50. I'm going to answer the question for the finance minister right here and right now. This is legislated poverty. That is what it is. And there is a cost to poverty. I always try to make the investment case. When people live in poverty, their health care suffers. There are issues with justice, with police involvement. There are housing instability. There are mental health issues. So by not investing in the health and well-being of Ontarians, you actually are working against your goals. The goals that were stated in the throne speech, so beautifully delivered by the LG yesterday. So the 5% is tied to inflation. So not only are you legislating poverty, knowing, because the poverty rate is $14,724. That's what people on ODSP live on. That's impossible. It is not doable. And we all know it. And so when you talk about faith and hope and charity, let's think about this from a moral perspective, because that's what budgets are supposed to be. They are supposed to be moral documents that tell the people of the province who we are as a population. And it should explain what our priorities are, because everything else is just words on a paper. The other final issue that really was a missed opportunity, I mean, the government had an opportunity to course correct with this budget, because the inflationary rate was not 8.1% back in May. The healthcare crisis, we have lost 5,400 healthcare workers in 1 year. Wage suppression is undermining our healthcare system. I cannot say this any more clearly. I mean, you have the numbers right before you. Bill 124 is an insult to healthcare workers, education workers, and the public service as a whole. But in our healthcare system, you can plan all the beds you want, you can cut all the ribbons you want, but if you don't have a nurse, that bed will not be opened. And so, Mr. Speaker, Bill 124, it would have been one hopeful step for the people of this province if the Premier went to the emergency room, as he's been invited to go to, as has the Health Minister, and said, listen, I see you, and I recognize that a 1% cap on your wages for 3 years is a cut. It is a 7% cut when you have an inflationary rate of 8.1%. So at the end of the day, if you truly value healthcare and if you truly value education, then that investment, the return on the investment, is worth it, and it certainly is worth fighting for. And I'll return that next time.
Member for Waterloo has the floor.
Thank you very much, Mr. Speaker. As I was saying, the $225 million is this promise to offer cash for tutorial programming. It's interesting because when you do the math on this promise, it could come up to maybe $90, which is one tutorial session in a private sector, for instance. It could have been so much more of value to the people who are committed to public education in Ontario than one private session of tutorials. And quite honestly, Mr. Speaker, this is not a plan to help students recover from a very devastating interruption in their learning through the public education system and through the pandemic. This is simply a gimmick. Yesterday at the press conference, I found it incredibly interesting that when Colin DeMello actually asked the finance minister a question around the deficit reduction. You'll know, of course, that the deficit reduction is going to be $1.1 billion this year. There was an increase in some taxes. I beg the government to have another look at this $1.1 billion because this is cold comfort to the people who are waiting over 19 hours in an emergency room. This is cold comfort to the 911 operator who, from Dundas, who was at one point not able to dispatch an ambulance to a crisis. She was on the line with a woman whose baby was choking, and she was also on the same line trying to help a family deliver CPR over the phone. Those are the choices that are being made right now in our healthcare sector. So when we do say that these are life-changing decisions, there is truth to that. And I want the government members to hear this because both the Ontario Nursing Association and the Registered Nursing Association of Ontario and SEIU and the Ontario Health Sector, they have put forward very good recommendations around investment. $1.1 billion in an increase in tax revenues going down to a deficit when the healthcare system is in crisis is a choice that this government is making, and it is not centred on the people that we serve. And the 19.1 hours that folks are waiting in emergency rooms is an issue that is affecting all of our ridings across the entire province. No one is exempt from this kind of pain, Mr. Speaker. The finance minister said the entirety of the new net revenue would be put against the deficit and no new funding so far to overcome the ongoing hospital closure crisis. This is a quote from yesterday. I also want to point out, because I am the finance critic, that the proposed increase around healthcare funding, according to the Q1 levels, the Q1 quarter, was 5.92%. 5.92%. When inflation is at 8.1%, that is a cut to the healthcare sector. So you cannot say to the people of this province, we are, as the Premier did earlier today, we are investing historical amounts of money into the healthcare sector when you proposed a budget that did not recognize the inflationary pressures. Right. And at 5.92%, when an inflationary level is at 8.1%, you are actually admitting that you are cutting health care. And this is why the morale and the energy in the healthcare sector is so challenged right now, and it's so stressed. And this goes from midwives to the paramedics. Oh, and interesting enough, paramedics, you've given them a greater scope of practice. You've said, oh, you can do more, paramedics. Paramedics are waiting in emergency room drop-offs in those bays, the hospital bays, waiting to drop off people that they've gone to pick up. And there's no nurse for the pass-off to go. In fact, when the Liberals had this problem, which I do want to point out, when the Liberals froze hospital funding for 5 years, that was a cut a cut, a cut,
That's right.
a cut, a cut. And those cuts were never addressed. But at the very least, they actually created a new position in the healthcare system called the hallway nurse. You have created a position called batching, where you can actually drop off multiple people with one person, which is completely unsafe. And paramedics across the province have said, yeah, great, you want us to do wellness checks? We're stuck in hospital drop-off bays because there's no nurses to be had. The children's and social services sector also is seeing a 1.8% cut. So when you look at the most vulnerable, and as I said this morning, I mean, that is why we are all here. We are here to fill that gap and to make sure that when we invest tax dollars in the health and well-being of the people of this province, that investment, that the return on the investment is for the whole province as a whole. And after this pandemic, all of us should have a clear understanding that the health and well-being of the people that we serve is directly connected to the economy. If you think that a company is going to relocate to the province of Ontario when the healthcare system is in shambles, I have news for you. This is a direct disincentive for people to come, for companies to come to Ontario. The other point that I wanted to make is, especially after question period this morning, Mr. Speaker, because the disconnect, what we are hearing from the government side of the House around what is actually happening in our healthcare system it's alarming. It's truly alarming because, as my colleague here has said, in order to address a problem, you actually have to admit that the problem exists. A GTA emergency physician is inviting the Premier and the Health Minister for a tour of her emergency department so that they can witness firsthand the staffing shortages and crisis facing the province's healthcare system. I'd like to urge the Premier and the Minister of Health to actually take this extra step. There has been some language used in the hallway right outside here where the Minister of Health has said there is no, she takes exception or she regrets the premise that there's a crisis. We have so many examples from our ridings, so many examples that indicate that the crisis is real. Perhaps you are using a different definition of crisis. But this doctor has said, this is a true open invitation. I'm a professional, respectful person. There will be no hate, nothing but professional. I just want you to see what we are seeing. And this is what they're seeing. Emergency departments normally equipped with 3 doctors are sometimes down to 2. And with nurses also in critically low supply, patients are not getting the attention or the care that they deserve. She goes on to say, the waiting room is packed. There are people waiting on the floor. There's blood on the floor from patients who are bleeding. There's a long triage line, meaning there's a lineup of people. We don't even know how serious their illness is. So this is Dr. Noor Khatib. Dr. Khatib said, even after ER patients wait hours to be admitted to the hospital, she'll watch them wait up for 2 to 3 days for a bed. I and we on this side of the House would describe this as a crisis.
Absolutely is.
And then to add insult to injury, because this is the truth around wage suppression. Your policy on wage suppression in the public sector is undermining the strength of our healthcare system. Since, in the last year, 5,400 healthcare workers have left that profession. We cannot retain healthcare workers when the government has a bill on the books that limits those wages to 1%, especially when we have an inflationary rate of 8.1%. As Doris Grinspoon said yesterday from RNAO, this is a 7% cut to nursing. So those nurses, they are going elsewhere. Many are going across the border to the States. So they'll still live in Windsor, but they'll go across the bridge and get a really good job in the United States. And they're getting incentives, and they are getting perks, and they are getting working conditions that provide some integrity and dignity, not only to those patients, but to them, to their colleagues. And it's interesting that a nurse on that side of the House is heckling me, because I believe you take an oath. I believe you take an oath. As a nurse and as a doctor. that you put the patients first. Bill 124 is wage suppression legislation. It is hurting the nursing profession. It is hurting our healthcare system. The results are indisputable, and yet you continue to disrespect the very people who saw us through a health emergency and a global emergency through the pandemic. I do want to say one final thing on that, because until you actually acknowledge that this is the reality in our healthcare system, I worry. The mental health piece was mentioned in the throne speech yesterday, Mr. Speaker, and I just want to finish on this point. I started the election, the first day of the election, attending a visitation of a young woman who died by suicide. That was day one. And she waited for 2 years for mental health supports. Thank you. Her name was Caitlin Roth. She was a friend of my daughter's. And the mental health funding that was in the budget that you tabled and then you ran away to an election is insufficient. It is insufficient, because this young woman came into contact with 27 police officers. Think of the cost to the Halton Police Services and the Waterloo Police Services, and the cost to her family and lost productivity, and the fact that she was stuck in a hospital that was not prepared or equipped to deal with mental health. So, when I say that budgets are moral documents, I mean it. And this budget and the throne speech and the language within that throne speech, which only addressed in a very insulting and demeaning way the ODSP rates, which are legislated poverty for the people of this province, and the fact that you are continuing to undermine public education, this does not instill confidence in us as legislators or in the finances of the province of Ontario. And when you do that, you hurt our democracy and you hurt the people of this province. And I would urge you to course correct. You have time to do it, and we want to help you do it. Thank you very much, Mr. Speaker.
Thank you. Further debate.